The only organ in your body that when it's cut into half, it can grow back out again is the liver. That's the only organ in your body. When we cut it into half, it can grow out again. Why would we want to mess our liver up by indulging in behaviors that can be avoided? Let's talk about fatty liver disease, okay? Another name for it is hepatic steatosis. It's super important to know, all right? This actually comes where there is some cells in your liver called hepatocytes. Hepatocytes receive fat into your liver, and then it saves some, and then it transports the rest into the rest of the body. But once hepatocyte is receiving too much fat, hepatocytes decline. When there is declination of the hepatocytes, what happens is there is too much fat built up in your liver. We don't want that. Okay, we have to talk about two main types of fatty liver disease. We have the non-alcoholic fatty liver disease, or the NAFLD, that comes from insulin resistance, leading to obesity, leading to type 2 diabetes mellitus. High triglyceride or high cholesterol levels can cause it too. Metabolic syndrome can cause it too. Dyslipidemia or too much fat in your blood can cause it too. Pay attention. Your hemoglobin A1C level spiking up high can cause it too. High blood pressure can cause it too. All right. If we don't pay attention to this non-alcoholic fatty liver disease, it could lead us into something called hepatic steatohepatitis. That means there is too much inflammation in the liver at that point. So whilst we are at it, let's pay attention to it, okay? And number 2 on the list is the alcoholic fatty liver disease. We all know it. Too much excess alcohol intake doesn't do nothing but start saving all that fat in our liver, damaging our liver eventually. We should pay attention to it. What are the symptoms of fatty liver disease? It comes with fatigue, comes with unexplained weight changes. It comes with right upper quadrant discomfort. It's super essential to pay attention to it, okay? If we don't pay attention to these symptoms I just mentioned, it could lead to liver fibrosis, that's liver scarring. It could lead to liver cirrhosis, that means liver dysfunctioning. When liver is dysfunctioning, it could lead to liver failure and liver cancer. And me and you know it, cancer will kill a person. We don't want to get there. We have to stop and make sure we have some major lifestyle changes, all right? What causes this fatty liver disease? Like I mentioned, high triglyceride levels, high cholesterol levels, all right? Obesity causes it. Type 2 diabetes mellitus causes it. Medications like amiodarone, medications like tamoxifen, corticosteroid, they cause it. Unnecessary alcohol intake causes this too. It's very important, okay? Can it be reversed? Yes, it can be reversed. But before it can be reversed, I need you to pay attention to this information. Number 1 of the causes, or number 1 to 3 of the causes of currently liver transplant is this fatty liver disease. What can we do to reverse it? The alcoholic fatty liver disease, you need to permanently stop alcohol. Apparently, this alcohol is accumulating unnecessarily too much fat in your body. Why would we want to keep drinking this alcohol? Knowing very well it's damaging our liver. That could lead to cancerous levels if care is not taken. All right. The non-alcoholic fatty liver disease, we need to avoid unnecessary processed food, unnecessary saturated food, unnecessary oils. Okay. We need to indulge in great oils like olive oil. And even if we want to eat fat, we should eat fat like the avocado. All right. Omega-3 is super important. Walnuts are very important. Vitamin C and E, that's antioxidants, they are super important. Okay, it's very, very, very serious for us to know. Like, let's say onions, like, let's say carrots, very great. Okay, we need to stop eating these fried foods, these fast food, these processed foods. Okay, we need to indulge in a whole different routine. Let's lose some body fat. 7 to 10% of the body fat, when we lose it, we see that our liver is returning back to normal. I promise you. losing 7 to 10% of body fat, your liver might return back to normal. When you see your doctor, I want you to grab a pen and a paper right now, and I want you to write this lab work that you should give your doctor. We have the total bilirubin levels. The bilirubin levels may not even spike up high in the beginning phases of that fatty liver disease. Okay, it stays normal, and then in the end, it starts spiking up high. All right, we have the ALT, AST labs as well. Write it down, please. We also have the A1C, the hemoglobin A1C levels. Okay, hepatitis B and C levels is super important. We have something called GGT. All right, that's the gamma glutamyl transferase test. It's super important. Okay, the liver biopsy test, that is the gold standard test. Okay, we have the fibrosis scoring. The doctor is going to do that. We have the fibro scars that test the liver stiffness. It's super important. Okay, we need to have some lifestyle changes. All right, we don't want any liver unnecessary transplant. Whilst we are at the let's stop the alcohol. Whilst we are at the let's control our cholesterol levels. Whilst we are at the let's lose some 10% body fat, and I promise you, the liver will get better. Okay, let's avoid this alcohol. All right, let's take some great antioxidants, vitamin E, vitamin C. Let's make sure that we pay attention to these omega-3s, these olive oils, these walnuts, whole grains. They are great for the liver. All right, we don't want to have any fatty liver disease. That right upper quadrant pain is super, super real. I need you to send this to your friends down the street. I need you to send it to your cousin who is gaining weight. Okay, your auntie that started complaining of this right-sided pain, they need to see the doctor as soon as possible. Once there is too much scarring in it, it's not good. All right, I need you to send it to everybody else who is going through this issue. The lifestyle changes can help it. Foods can help it. Okay, my name is Nurse Solomon, and I'll see you soon.